I'm Dr. Cheryl Wisseh. I am a clinically trained pharmacist, a recent graduate of the CDU Master of Public Health program in urban health disparities, and a Phase 2 CRECD scholar. I'm also an assistant professor in the College of Medicine, the Family Medicine Department, and an assistant professor in the Department of Clinical Pharmacy Practice at UC Irvine School of Pharmacy and Pharmaceutical Sciences. I practice as a primary care clinical pharmacist at To Help Everyone Health and Wellness Center in South LA. In our recently published paper, Social Determinants of Pharmacy Deserts in Los Angeles County, we found that there were two distinct pharmacy desert types in LA County. And just a little bit background about pharmacy deserts. Pharmacy deserts were adopted from the food desert concept. And pharmacy deserts are basically areas that have limited access to pharmacies geographically. So back to our study, we found that there were type 1 and type 2 deserts. So when compared to type 2 deserts, type 1 desert residents live in areas that potentially compound the negative effects of having a shortage of pharmacy services. These desert types contain a denser population, per census tract, more non-Hispanic Blacks, more Hispanic residents, more renters, and more residents that speak English as a second language. There's less vehicle ownership and more live under the federal poverty level. More live in areas with higher crime against property and people, and there are less health professionals to serve the area. And what was interesting that when we look at all the different service planning areas, we found that a good 94% of the deserts in SPA 6 were type 1. This poses an interesting challenge concerning pharmacy services such as immunizations, preventive health screenings for hypertension, cholesterol and diabetes, and comprehensive medication management services, which comprehensive medication management services are very influential in regards to medication adherence for residents and patients in general. This could also pose a challenge regarding COVID-19 testing and vaccines as a safe and effective vaccine actually becomes available. And this is because the government has moved to expand pharmacy services and the pharmacist's scope of practice to provide those COVID-19 tests and the anticipated vaccine. So if there aren't pharmacies in these communities, they're less likely to have access to these COVID tests and these vaccines. And it's a problem because a lot of times these low-income communities, such as what we see that is under-resourced in SPA 6, tend to see higher incidences of chronic conditions such as hypertension, diabetes, asthma, which is also a risk factor for worse outcomes if they do contract COVID-19. A Pharmacy Deserts project could also expand in several ways, such as surveys to community pharmacies in LA County in general, just to assess the availability of common medications, and connecting primary care clinical pharmacists that are within different clinics with community pharmacies to provide that wraparound pharmacy-related care, whether it's through broad, just general medication management or targeted medication management for chronic diseases. So there are many opportunities to serve the community, and I'm glad to have Ms. Placidia Williams as my community mentor as she's helping me create interventions that are relevant to the community in SPA 6.